Good evening, I'm Glenn Mills.
And I'm Emily Flores. We thank you for joining us here this evening. We do begin with the postpartum health. Governor Spencer Cox declaring this month Utah Maternal Mental Health Awareness Month.
ABC4 Northern Utah correspondent Kate Gardner on Utah's Capitol Hill today, talking to lawmakers and advocates. So the question tonight, Kate, is what do they hope to see as a result of this declaration?
Well, simply put, they hope to see change. The declaration states that more than 50% of women in Utah report experiencing anxiety or depression during, before, or even after pregnancy. And a handful of lawmakers hope that this shines a light on the need to pass legislation that would address those needs.
He found me on the bathroom floor crying and telling him I wanted to die.
Heather Dopp is a mom. Her first pregnancy went smoothly, but during her second, she became suicidal.
There's a huge stigma around maternal mental health.
She says it doesn't always look like depression.
We have this case in Massachusetts where this mom just took the lives of her children. That is postpartum psychosis that went untreated, and it's 9 months postpartum that is still in the warning period.
I would say that helping maternal health also helps maternal mental health.
Representative Raymond Ward supports a couple bills that would focus on doing just that. House Bill 415 would require the Public Employees Benefit and Insurance Program to cover doula services. Bill sponsor Representative Ashley Matthews says this would give mothers another advocate during pregnancy.
Problems with maternal mental health affect more than just the individual. It affects the entire family.
Representative Rosemary Lesser's House Bill 85 would extend Medicaid coverage to pregnant women from 60 days post-birth to 1 year.
We recognize that the complications after childbirth extend for much longer than 60 days.
It would also expand coverage for mothers with a household income less than or equal to 200% of the federal poverty level.
Right now we're tied for last place, so we're not alone in last place, I guess, but we're also tied for last place with the lowest level of coverage amongst the states, and we can do better than that.
With help, you'll be well, and that's what we need moms to know, is with help, you'll be well. You're not a bad mom. You're not alone. It's so common, and there are resources.
According to the governor's declaration, from 2015 to 2016, 75% of maternal deaths in the state were associated with a current or prior mental health condition, and 95% of those deaths were preventable. Reporting from Capitol Hill, Kate Garner, ABC4 News.